Okay, welcome everyone. So welcome to this noon meeting, which is taking place entirely virtually, and Leslie didn't read the message. So I'm standing in a completely empty seminar room too, except for me, which is why I'm not wearing a mask. Today we are going to be having a talk about human rights, and it's entirely appropriate in the month of Human Rights Day that we address questions of human rights. I'm very, very pleased that Remmy Shawa has been able to join us. Remmy is a graduate of our MPH program and a PhD with us, and his PhD was actually on the topic of the right to enjoy the benefits of scientific progress, and he's now working with UNESCO as a senior officer in the region. So we're very pleased. He's going to talk to us about the human right to enjoy the benefits of scientific progress and the UN General Comment 25, which he will explain, and what implications it has for us as health researchers. So thank you very much for making the time, Remmy, and over to you.
Thank you so much, Leslie, for having me and for that introduction. Let's see, yeah, there I am, just to put the face behind the voice. So good afternoon, colleagues. Thank you so much for joining us. As Leslie mentioned, I'll be looking at or talking about the human right to enjoy the benefits of scientific progress and, the implications that, it has for the right to, for the work that health researchers do. Please just let me know if the sound is not clear. So my presentation today, I'll look at the right to enjoy the benefits of scientific progress. So please don't worry if it's the first time you're coming across it. I didn't know about this right before I started doing the PhD myself. And then we'll talk about the UN General Comment 25 and what it is and try to unpack it, as well as some implications that has on health researchers. And maybe hopefully we can have a short discussion at the end. So let me start first of all by just sort of mapping, where the right to enjoy the benefits of scientific progress sits within the broader United Nations sort of human rights framework. As you might know, at the foundation of human rights framework is the Universal Declaration of Human Rights, which sort of gave birth then to the International Covenant on Civil and Political Rights, as well as on economic, social, and cultural rights. So the RSPP, or the right to enjoy the benefits of scientific progress, sits in both the Universal Declaration of Human Rights in Article 27, and also in the International Covenant on Economic, Social, and Cultural Rights, and would try and see, what they exactly say about that right. And then if you look at the two covenants, which are the sort of the most important covenants and being differentiated from the Universal Declaration, is that they are more legally binding. So countries that have ascended and signed the two covenants are legally bound to deliver upon the rights found in these two covenants. And then they also give birth to the different treaties and commitments at the international level. So you will see, for instance, a list of international treaties on the left, and as well as general comments, and I'll explain what these UN general comments are. So if you look at the Universal Declaration of Human Rights, which, like I said, is sort of the Bible of human rights, or the foundation of human rights, you'll find that in Article 27, it speaks to everyone having the right to freely participate in the cultural life of the community, to enjoy the arts, and to share in scientific advancements and its benefits. And then if you look at the International Covenant on Economic, Social, and Cultural Rights, it then sort of takes that a little bit further and says everyone has the right to enjoy the benefits of scientific progress and its applications sort of in particular, and that is under Article 15, paragraph 1b. So if you're looking at human rights, any human rights really, there are some general obligations that apply to those human rights. Some of these are non-discrimination, so the application or enjoyment of those rights cannot be discriminatory. Progressive achievements, especially for economic, social, and cultural rights, that they can be achieved or realized in a progressive nature and not necessarily once off. And then also they're bound to maximum available resources. So, you'll get this conversation quite a lot in dialogues with member states in terms of how far they're going in the realization of certain rights. They'll tell you, there's not enough resources to, for instance, realize the right to health or the right to food and so on. So they are subject to maximum available resources that member states have. And then here now I try to show exactly where the right to enjoy the benefits of scientific progress within the Covenant on Economic, Social, and Cultural Rights sort of sits. And it's sort of difficult to separate this right from others. So as you will see in Article 15.1, it says the state parties present to the Covenant recognize the right of everyone to take part in cultural life, to enjoy the benefits of scientific progress and its applications, and then to benefit from the protection of the moral and material interests resulting from any scientific, literary, or artistic production of which he is the author. So if you look at these two, B and C, for instance, it is sort of two arms of one thing. On one hand, it is about the production of science or research and generation of knowledge and so on. And then on the other, it is about realizing the applications and enjoying the benefits of it. Point C sort of protects the rights of the author, of the researcher. Point B goes further to also include the users of that researcher. So the balance between the producers of science and the users is quite important and very political. So if issues around patents and all fall under C, where authors or owners of inventions will say we need to protect our moral and material interests, while as advocates of human rights for communities like disadvantaged communities would then push for the realization of B, which is access to those applications and new knowledge. So that balance is not easy to maintain. And then the article also talks about the steps that the states need to take in order to realize the full realization of the rights, and also just the diffusion of science itself. All right, so each of the treaty bodies, remember that slide on the different treaties. So each of the treaty body publishes its interpretation of the provisions of its respective human rights treaty in the form of general comments, or if you would like to think of general guidance, right? Trying to explain and interpret that particular right, in particular looking at what it means, what obligations it entails on the states, as well as responsibilities of non-state actors, but it also looks at the entitlements of that right for the right holders, as well as the different steps that the state can take to realize that right, or to respect, protect, and fulfill that right. And then on the right, I just show the different treaty monitoring bodies. And the one that we are focusing on is the treaty body on the International Covenant on Economic, Social, and Cultural Rights, also known as the Committee on Economic, Social, and Cultural Rights, or the committee in this conversation. So then, the Committee on Economic, Social, and Cultural Rights published a general comment in 2020 the General Comment 25 that sought to introduce and sort of expand the right to enjoy the benefits of scientific progress. In fact, before that, the committee had issued a general comment on cultural rights, a general comment on the protection of the authors of scientific knowledge and applications, but nothing on the right to enjoy the benefits of scientific progress itself. In fact, this was one of the reasons why I embarked on the PhD, to look at conceptualizing this particular right and providing some guidance on what it means and what it entails, both for the users and the producers of science. And we did also, together with Leslie and Helen, submit to the United Nations and this committee some of our recommendations on what the general comment should look like and what it should entail. Happy to see that most of the things that we had proposed actually were integrated into the General Comment 25. So at that stage, we can safely say, at least at the level of the United Nations, there is some guidance on the right to enjoy the benefits of scientific progress in terms of what it means and entails. So the General Comment 25 tries to define science, and I won't go into detail to read this long rhetoric definition, but borrowed from UNESCO. And some of the things that are highlighted in the definition of science around, it being organized and objective, it being validated through sharing of findings in data, as well as peer review. The general comment also adds that science, which encompasses natural and social sciences, so that's also important, because often when we think science in the like community, at community level, we usually think of natural science, but it's important to note that it tackles both social and natural sciences, and refers both to a process of following a certain methodology, so that's the act or the process of doing the science itself, as well as to the results of the process, i.e. knowledge and applications. And then the committee also looks at enjoying the benefits and what that means. And it sort of separates these into two. Material results of the applications of scientific research, such as vaccinations, like we saw in COVID-19, in the case of COVID-19, fertilizers in the case of agriculture and food, as well as technological instruments. So that's the material results. But acknowledging as well that science, the benefits of science can be in the form of scientific knowledge, that is an important information directly deriving from scientific activities. So there might not be a product resulting from scientific advancement, but it can create new knowledge. What I found in my PhD study was one of the most difficult things was to define scientific progress or advancement. So if you remember, the Universal Declaration uses the term scientific advancement, and then the Covenant on Economic, Social, and Cultural Rights talks about scientific progress. But I think the emphasis is on the capacity of science to contribute to the well-being of persons and humankind, and the General Comment 25 also reiterates that. And it also says that scientific progress, so progress in itself is a normative term that needs to be separated from descriptive terms like development or change. It is also about demonstrating that some type of value has been added to improve science in both in theory and in practice. So for there to be progress, scientific progress on X, there should be some value addition, and it might not be in terms of a product, but it could be in terms of understanding the phenomena or new knowledge. I also like what the United States National Research Commission sort of tries to do in unpacking scientific progress, and it looks at it from sort of 5 different areas. discovery, which is about showing existence of phenomena or relationship between phenomena, analysis, which is about developing typologies and concepts, explanation is about explaining phenomena, integration is integration of theory, and then development is something that stimulates further research or research and development. So general comment 25, in terms of introduction and basic principles, I think it's important for us to note, has the primary focus on the right to enjoy the benefit of scientific progress and its application, which is, like I showed, Article 15(1)(b), but that is not the only focus. So primarily it focuses on that, but it also tries to develop more broadly the relationship between science and economic, social, and cultural rights. Remember that that's what the committee is about: economic, social, and cultural rights. So how does science relate to the right to health, or the right to housing, or the right to food, etc.? It also examines the other elements of Article 15 related to science, especially the obligations of the state parties, like I showed Article 15.2, to respect the freedom of the freedom indispensable for scientific research, 15.3, and to promote international cooperation in science, Article 15.4. It also highlights the relevance of Article 27 of the Universal Declaration of Human Rights. So the general comment says that the right to enjoy the benefits of scientific progress contains both freedoms and entitlements. And I think this is important to note in sort of unpacking the right. Freedoms include the right to participate in scientific progress and enjoy the freedom indispensable for scientific research. So, for instance, health researchers on this call have the freedom and the right to participate in scientific progress. That is, to contribute to, scientific progress and advancement, and to do research, right? And then it also has entitlements, which include the right to enjoy, without discrimination, the benefits of scientific progress. So whether you are the author or the user. And I like this bullet in the general comment that says large-scale privatization of scientific research without any other consideration might have negative effects on the enjoyment of this right. So the privatization at a large scale of scientific research can be detrimental to the enjoyment, and not just to this particular right, but to other rights, like the right to health. So for instance, the question we really need to be asking ourselves is, what drives the research agenda, especially health research? Is it capital, or is it need-based? Is it population-based, and so on? So really will be interesting to hear your thoughts at the end of the conversation. It also says, that's the general comment, that with due respect to scientific freedom, some decisions concerning the orientation of scientific research or the adoption of certain technical advancements should be subject to public scrutiny and citizen participation. So how we decide what research we do or we conduct, to some extent, needs to factor in the public and the population, as well as the needs and their participation. So again, another question is, to what extent do we as health researchers, you colleagues as health researchers, engage the public in determining your research priorities? Another thing that the general comment gives us are some core obligations that's on the part of the states or state parties. And it says that despite progressive realization of the covenant it imposes on state parties various obligations which are of immediate effect. Remember, at the beginning, I mentioned that the economic, social, and cultural rights are subject to progressive realization, meaning that there isn't an expectation that we realize each and every economic, and social, and cultural right at the same time and immediately, but it is progressive. However, the committee says that there are some elements or obligations within the right to enjoy the benefits of scientific progress, in particular, but more generally, the whole covenant that are of an immediate nature or have an immediate effect. One of which is non-discrimination. So a member state cannot say we are progressively realizing the right, but at the same time discriminate against certain populations. So non-discrimination is something that does not even require progressive realization. It must be immediate, and to some extent does not require financial resources. Remember, we said it's subject to maximum available resources. So non-discrimination is one of those, if you wish, non-negotiables in terms of realizing the right to enjoy the benefits of scientific progress. And then taking steps which are deliberate, concrete, and targeted towards the full realization of the right. So even if a member state says that they are working towards the realization of the right, the question would be, what deliberate steps, what concrete, what targeted steps are they putting in place to realize it? So they can say, for instance, we've developed a national framework of law on science, for instance. So we have a national policy on access to scientific applications.
Sorry, Remmy.
Yes, please.
Sorry, it's Imperial. Do you mind just resharing your screen, because there's some glitch in your presentation, or from our side, that it's sometimes dark, or it has a green screen and it's lagging.
Okay, is that the case for everyone?
Yeah. Well, about 4 of us are experiencing this issue.
Right. Let's see.
There we go, and then just reshare again.
Okay. Can you see it?
Not yet. Yeah, general comments. Yeah, thanks.
Yeah, okay, sorry about that.
That's okay, thanks.
And then the other thing that the general commenters will say is that retrogressive measures taken in relation to the right to enjoy the benefits of scientific progress are not permissible. State parties have the burden, therefore, to prove that they have been introduced after the most careful consideration of all alternatives and that they are duly satisfied. So if they retrogress or they put some limitations that they need to be really justifiable within the principles of human rights. Examples of retrogressive measures in respect to the right to enjoy the benefits of scientific progress could include the removal of programs or policies necessary for the conservation, the development, and the diffusion of science, the imposition of barriers to education and information on science, the imposition of barriers to citizen participation in scientific activities, including misinformation intended to erode citizen understanding and respect for science and scientific research, and the adoption of legal and policy changes that reduce the extent of international collaboration on science. All right, so within the framework of triple AQ, which is sort of the framework that the right to enjoy is the Committee on Economic, Social, and Cultural Rights has adopted across all human rights within the Economic, Social, and Cultural Rights Covenant. We're looking at availability, accessibility, acceptability, and quality, and this framework now being applied to the right to enjoy the benefits of scientific progress. What does that mean? What does availability mean with respect to the right to enjoy the benefits of scientific progress? So the committee sees that this means, that scientific progress in areas essential for the dignity and well-being and the quality of life is actually taking place. So there has to be scientific progress happening, at different levels. So it must first and foremost be happening. And accessibility is all about accessibility of both benefits of such scientific progress in ways that are fair, they are non-discriminatory, and that do not interfere with the enjoyment of other human rights. Acceptability refers to both the means by which scientific progress is achieved and results of such scientific progress, guaranteeing that they do not violate human rights and are culturally appropriate. So, for instance, is the research that you want to embark on acceptable? Have we considered the different dynamics, including the cultural appropriateness of that particular research? And even when the research is conducted and the results, or whether it's knowledge or actual tools or applications, are they acceptable to the intended target audience? And then good quality outcomes of scientific progress, so the effectiveness and both in terms of the process by which such scientific progress is attained, but also the quality of the outcomes of the results of that scientific progress. So now, having sort of looked at what the right to enjoy the benefits of scientific progress entails and how the Committee on Economic, Social, and Cultural Rights defines it and unpacks it, what does this mean in terms of the implications for health researchers? And some of these are picked, from the general comment itself. For instance, ensure that scientific progress is actually taking place. So remember, availability. So for scientific progress to be available, we need to invest in the actual, research and development, the actual science, and that scientific knowledge and its applications are protected and widely disseminated. I think quite a number of researchers or health researchers are guilty of not widely disseminating the knowledge from the research, especially for non-academic audiences. So that's, I think, that's a passion of mine. How does the research that happens in an academic space contribute to normal people's lives? And then scientific education and the products of science should be tailored to the particularities of populations with special needs, such as persons with disabilities. So the general comment specifies the need to target and tailor the products of science to these populations. So you can add among these populations vulnerable groups. So if it is research that is on tuberculosis, for instance, people directly affected by TB should be put in mind, and that whatever results are produced should be tailored towards such groups. That's the recommendation. And that efforts should be made to ensure that science is explained and its applications are disseminated in such a manner as to facilitate their acceptance in different cultural and social contexts, provided that this does not affect their integrity and quality. So that balance is important to maintain. And the most advanced, up-to-date, and generally accepted and verifiable science available at the time should be used. So this is not just in terms of the conducting of science itself, the production of science, but even the dissemination and the application of that scientific progress. So, and here's a silly example. You've done a research, and although you have access to up-to-date and sort of advanced ways of sharing that information, you then just end up putting that research in a book, and then it is shelved. So how do we utilize advanced and up-to-date ways, both in terms of conducting research and verifying science, but also in dissemination? This element here, like I mentioned, applies both to scientific creation and to accessing the applications and benefits of science. And then the General Committee also says that scientific research has to incorporate ethical standards. I think this is a no-brainer, and that is why we have institutions that oversee research ethics. But important to just also note that the ethics within that research should go over and above what is expected either by law, but looking at the morality of the research. How do we, for instance, feel accountable as researchers to the populations we are working with? We've had cases, previously where researchers go into a community, collect data, and then move out without the feedback to the community or even linking whatever findings to the well-being of the community. The benefits of research to research participants and other affected individuals should be maximized and any possible harm minimized with reasonable protections and safeguards. The autonomy and free and informed consent of participants should be guaranteed. Again, I think that's something that a lot of health researchers try to tie in and build into their research. Privacy and confidentiality should be respected. Vulnerable groups or persons should be especially protected in order to avoid any discrimination. And then lastly, cultural diversity and pluralism should be given due regard. So that's in the case of health researchers. And I thought that we should also try to think of it in terms of institutions, right? So above and beyond individual researchers themselves, what can institutions possibly do to advance the right to enjoy the benefits of scientific progress in the context of what the general comment has tried to recommend? So the research institutions can ensure access to research facilities, resources, and infrastructure without discrimination, and to prioritize research that contributes to the health and well-being of the population, especially the vulnerable groups. The research institutions can also deliberately have in place an agreed list of essential research, which is critically needed to address public health challenges. These institutions can also try to equitably distribute research resources between rural and urban so that the rural-urban divide is sort of closed. And then can try also to prioritize the production of science in most neglected diseases, so not and for the most vulnerable populations. So both areas of neglect in terms of diseases, but also in terms of vulnerability of the population. A research strategy of a research institution needs to be periodically revised and through a transparent and participatory process, and must include, where possible, sort of a scorecard and a monitoring framework to be able to judge, progress. So, coming to the end of this this presentation, some of the questions that I'd like for us to reflect on is what practical things can researchers do to support the realization of the human right to enjoy the benefits of scientific progress in the context of health researchers. And this is not just in the production of science, but also in the sharing of scientific progress as well as knowledge, products and knowledge. And what existing strategies do you know of that promote community participation in research and development, both in the area of the doing of research as well as the application? And that ends my presentation. Thank you so much for your attention, and I look forward to the discussion.
Okay, thanks so much, Remmy. We had a few technical glitches with the presentation, but I think in the end it was fine. And I think we had quite a lot of challenging ideas there, so I'm opening it up for comments and questions. I didn't see any particular comments in the chat, but any questions from the floor? Virtual floor? Ntiki, you're up.
Thanks, Remmy. Yeah, I mean, I think this is useful. I thought you would touch on this, but I mean, the one thing that has been interesting about the pandemic is that we had free reign. We could access, all the journals and get the most up-to-date information. So I was wondering if beyond this, if there's going to be provision for that to continue. I suppose not all of it free, maybe a certain percentage, maybe 10% of published articles, in international journals and also within. I mean, I do understand that there will be competing interests, they want to make money, but I think in the interest of us having that access and enjoying, those benefits to the products of scientific research, I mean, I would think that this is something that is within the realm of UNESCO and other bodies that have the power to negotiate on our behalf. So I hope we could have, that access. But then the other thing that I wanted to speak to, I mean, it relates to the questions that you have posed, is around this variable access to research and the fact that if you're looking at, particularly within our context, that the focus tends to be on researching vulnerable populations. So that would include your rural and underserved communities. And in doing that, really, we are being denied an opportunity to understand what is happening, so in South Africa globally. So for instance, if we're looking at TB, I mean, is TB only a condition that exists within these vulnerable communities? Does it not occur in the other aspects of the population? And I mean, again, that goes for all the other conditions. So if we're talking about, this access and the benefits that should accrue, should we not have access to everything and everybody? Should it only be about vulnerable communities? So that is my question to you and perhaps to my colleagues.
Okay, thanks, Ntiki. Remmy, there are two other questions. I don't know if you want to hear the questions or you want to deal with them one at a time.
Yeah, I can hear the questions.
Okay, so then there's Hannah and then Pancho, if you want to pose your questions. Hannah? Hannah, you need to unmute.
Am I unmuted?
You are now unmuted, yeah.
Okay, great. So, Remmy, thanks for a very interesting presentation. I think there are lots to think about, and I probably have more comments and questions. So I'd just like to add that for research institutions such as UCT, in terms of if we want to strengthen the dissemination and the information and the scientific knowledge beyond academia, that research institutions need to maybe make it a requirement for research and to put greater acknowledgement of that aspect of dissemination. And the second comment is that those recommendations you listed, I suppose, should also be applied to funders, so that encourage funders to have policies that reflect the values and the recommendations, so that they look at research on vulnerable populations, and that they again put emphasis on the right to scientific knowledge beyond academia. So that was sort of my comment.
Okay, thanks, Anna. Pancha? Pancha, you're up. Can't hear you, Pancha. We can see you. We can't hear you. Okay, I think I'll ask Remmy just to respond to the two questions. And Pancha, if you can maybe find out what's wrong with your microphone, you can come back after that. Okay, over to you, Remmy.
Thank you so much for the reflections and also questions. I think that the first one on how UNESCO, and I'm not speaking on behalf of UNESCO here, so I'm careful not to overstep my influence. But I do know that colleagues have been working within UNESCO around open access to scientific information on a program called Open Data. I'm just going to put the link here in the chat for you, to read about more and see which research journals UNESCO is collaborating with to really increase access to scientific data and resources, especially for member states that whose populations obviously struggle to access such. But I do agree, I think that perhaps at a global level, more voices, especially within the international organizations like UNESCO, need to really champion this whole concept of access to information and picking some lessons, like you mentioned, from COVID-19. Then I think the other question was whether or not such access should be only limited to vulnerable populations if it is, for instance, scientific advancement for sort of which affects vulnerable populations. I don't think that it should be limited to vulnerable populations, and I don't know what others think, but I imagine that even if it was a research looking at an illness that is affecting vulnerable communities, the solution might be outside that community. So therefore, I think highlighting the importance of sort of cross collaboration and sharing of such knowledge, and also what the the covenant does, or the general comment itself, it encourages international collaboration. And it's not just in terms of member states or state-to-state collaboration, but also in terms of researchers and research institutions. So definitely, I think even for communities that might not be perceived as being affected by a particular health problem, there is a value in ensuring that there's collaboration with such communities. And thanks, Anna, for the comments. I totally agree with you. I think a requirement on dissemination of research findings, both from the level of institutions like UCT and funders, is important. When I was doing my research, there are some research projects, for instance, who already had sort of in their agreements with the funders an agreement to disseminate the findings and to access such data and such information, but not obviously not everyone. So that's obviously something that I think we can champion. Thank you.
Okay, thanks, Remy. Pancha, you're up. Pancha, did you sort out your sound? Yes. We can't hear you, Pancha. Okay, I think post your question in the chat, Pancha, and then we'll pick it up. Remy, can I just bounce this sort of back to you about the idea that the international collaboration. So we've seen with the COVID epidemic a lot of discussion around local production, local development of vaccine. And clearly having access to vaccines is an explicit form of benefiting from scientific progress. But on the other hand, we have trade agreements and other kinds of agreements which militate against the sharing of information and the sharing of know-how. So how do you read the trade-off between international agreements which limit dissemination of information with this obligation on states transnationally to support the dissemination of information to people who need who could benefit from the research?
That's a very difficult question, Leslie.
It's only you that I would ask the question.
Yeah, but I think that, and I saw this also when I was, doing my research, that I think what the General Committee has tried to do is to differentiate between, for instance, intellectual property rights or property rights from human rights. And, it has kind of made it clear that property rights are not necessary to the extent that we understand human rights all and all. So I would imagine that really issues around, for instance, protection of one's material and knowledge is categorized under property rights. And I don't think that it should trump, for instance, other human rights like the right to health. Yeah, and I think that, perhaps that's what even the General Comment tries to say when they say the large-scale privatization of research can have adverse negative impacts on populations. And that's something that we might, in our advocacy work, would obviously want to push for, where we prioritize human rights like the right to health, the right to food, and so on, far and above beyond the material or property rights. And we saw that, for instance, in the case of HIV/AIDS treatment in South Africa, with advocacy groups like Treatment Action Campaign, really advancing or pushing forward the right to health to really go beyond the right of big pharma to their drugs and the medicines, and using also the TRIPS agreement, which is an international agreement that has in it some flexibilities, which provide for countries who might have health needs to really make use of those flexibilities, even if they fell during the patent period of a particular drug. I don't know if I have answered your question, but yeah, it is a tough one.
Yeah, I think it's an ongoing discussion, and there's no simple answer to that. Are there any other comments or questions? I see a second hand. Hang on, there's a second hand here. So Pancha has been immobilized. Nandi, over to you.
Hi, Leslie. I posted in the chat. I'll just read it out. Thanks, Remy, for a great presentation. Would you comment on how well or not you think the academic enterprise models good REBSP. For instance, internally within institutions and between institutions, we know that competition is favored in the research enterprise over collaboration. And that can lead to researchers not sharing tools, resources, data, etc., and means we lose valuable efficiencies in the whole system, and that ultimately affects the AAAQ and impacts on overall benefit to everyone. Perhaps there's some ongoing research looking at this through the human rights lens. Love to hear your opinion and thoughts.
Yeah, thanks so much, Nandi. I do agree with you. I think that the competition versus collaboration sort of model in research does eventually affect access to the right to enjoy the benefits of scientific progress, not just for the researchers involved, but also for the end users or the intended end user. I'm not aware of any research done on this particular component, but that would be something interesting to look at. I have also, and this is by just speaking to, for instance, colleagues in academia who have sort of noticed that increasingly publications, for instance, that have or show more authors or more collaboration between or among multiple institutions now tend to sort of get favored, as opposed to a single author or single institution publications. And I hope that, that might, whether it is deliberately or not, encourage more collaboration between institutions, but also among researchers.
So thanks. There's been quite a discussion in the faculty around promotion criteria and the way promotion criteria sort of atomize achievement to being your individual achievement and doesn't reward collaboration. People will have different opinions as to whether it does or doesn't and whether it's desirable or not. Within the faculty, we've seen that discussion. But certainly it is the case that you don't really get rewarded on the basis of collaborating. You get rewarded on the basis of quite conventional kinds of indicators. And at one stage, our school was actually looking at simply tracking the number of publications where there are authors from different divisions or units within the school reflecting collaboration. We didn't use it for anything, but it's maybe something useful for us to pick up again going forward. Any other comments or questions? So we nearly at the end. I just want to round off by saying that there's been actually quite a vociferous discussion among some people about article publishing fees and the way this excludes people and acts against the tenets of enjoyment of scientific progress. So we are going to table a question in our faculty board to the university executive to ask what are they doing about it and could they do something about it. And now we have Remmy at UNESCO, so you can wait for the inquiry from universities trying to take up the problem, because as we know, article processing fees, it's one thing to get the funding to cover it, but they are huge. And the publishing industry, academic publishing industry, is particularly profitable for academic publishers. So the business model is really extracting quite a lot of surplus out of the academic publishing process in different ways. And a more sustainable business model is needed, and we hope that the arguments around the right to enjoy the benefits of scientific progress could push publishers in that direction with the support of UNESCO in this month on National Human Rights Day. If there are no other comments, are there any other comments? I don't see any. I want to thank Remmy for a very stimulating presentation. And we will have this, it's recorded, so people who weren't here can catch it up. And if you have any questions, I'm sure Remmy would be happy to answer them, and I'd also be happy to facilitate a discussion. I really think this is a much neglected area and something which is strategically very important for the academic project. It stretches right from laboratories to applied research in communities, because it really puts rights into the research field. So I think that really is a good way to close the discussion around what the implications are for health researchers, because we can also advance rights in our research. And I think that's the take-home message. So So thanks very much, Remmy, and thanks very much for everybody for attending, and thanks for Superior for sorting out some of the technical glitches. And we'll see everyone next week at the next noon meeting. Thank
you so much, everyone. Bye-bye.
Thanks all.